My name is Dr. Shelly Noe, and I am an assistant professor at the School of Nursing here at the College in Health and Social Services. I began teaching at NMSU in 2004 as a clinical instructor for the Doñana Community College. I completed my Master's of Science in Nursing, specializing as a psych mental health nurse practitioner. And as a psych NP, I went to work for the Public Health Department here in Las Cruces. And in that role, I was instrumental in developing the first Suboxone program here in southern New Mexico. So I also worked with individuals who had opioid use disorders, substance use disorders, and co-occurring mental health illness. Some of these patients also suffered from HIV and hepatitis C. So I was hired by the NMSU School of Nursing as adjunct faculty in the psych nurse practitioner program. And at that time, it was called the MIND program. So while I was working adjunct faculty and at the Department of Health, I was also pursuing a doctorate of nursing practice, a DNP degree here at NMSU. I graduated in 2013, and at that time I was hired as an assistant professor on the tenure track and also the program director for the psych mental health DNP track here at the School of Nursing. So my defined area or focus of research is to increase access to interdisciplinary treatment of opioid use disorders, OUD, and substance use disorders, SUD, for individuals who are seeking recovery. And in my practice, I work in a private practice for another individual. I specialize in individuals who need treatment for OUD, SUD, and have mental illness. And most of the individuals that I provide treatment for are specifically high risk or vulnerable populations. So individuals who are in the judicial system or have comorbid mental illness or public illness diseases. And my goal is to expand the utilization of medication-assisted treatment in order to ultimately provide improved prevention, treatment, and recovery interventions. So what I mean by medication-assisted treatment is the use of Suboxone and Vivitrol and other medications that we use for explicitly opioid use disorder and substance use disorder. So my position here at NMSU has really allowed me to collaborate with the other faculty, not only in the School of Nursing, but across campus. I'm currently the principal investigator for a $1.3 million HRSA grant, the OWIP grant, and that stands for Opioid Workforce Expansion Program. The purpose of the program, it's a 3-year grant, and we are increasing the number of professionals in New Mexico, in particular southern New Mexico counties, who are trained in interprofessional settings and to effectively prevent and treat OUD and SUD. The program provides stipends for psych mental health nurse practitioner students, counseling, psychology doctoral students, and Masters of Social Work students. I'm also a project co-director for a grant, Department of Health and Social Services grant. And the overall goal of that project is to deliver behavioral health and OUD, SUD prevention and treatment services that are culturally and linguistically competent, they're integrated, trauma-informed, and again, that interdisciplinary team-based care. At present, I'm serving as an academic team member and a content expert on a $200,000 Department of Health and Human Services grant and a SAMHSA grant, so Substance Abuse and Mental Health Services Administration. This title of this one is Integrating Substance Use Disorders and Opioid Use Disorder Education and Clinical Competencies throughout the curriculum of the Family Nurse Practitioner program here at NMSU. So what we've done is interwoven OUD and SUD content throughout the curriculum so that we can improve that knowledge and that effectiveness of those providers. So, you know, I do also provide some outreach, and what I do or have done for the last 11 years is to serve actively on the State of New Mexico Board of Nursing Diversion Program. And this program was developed to rehabilitate nurses who are either impaired because of use or abuse of illicit substances or alcohol. And the program works to monitor those nurses and provide therapeutic support so that nurses are able to be treated and return to practice or continue practicing while they're in the program. I'm an active member with the New Mexico Opioid Hub, and I also participate in the Opioid Plus 360 Committee here in Doña Ana County. So that is my area of interest and my contribution to NMSU. And thank you so much.